Welcome back to our channel. Today we have another fascinating topic, and I think it resonates with a lot of people, and that is when you choose, after all your research, choose to have a form of plastic surgery.
Yeah.
Where do you have it done? Okay, which I think is really interesting because we see a lot of problems. So today we'll talk about deciding how we choose where we have plastic surgery. My name is Dhalia Masud. I'm a plastic and reconstructive surgeon.
Rachel, practice manager.
I'm Hayley, hello.
Brilliant. You've decided, or your friend or family members decided to have a breast reduction or a tummy tuck. What factors would you look at to decide where you would have it done?
There's going to be two factors, isn't there? One, do you want to do it locally? Ideally you would, so you don't have to travel so far because you've got that recovery trying to go home. And secondly, price. Because you know what I'm going to say.
Yeah.
You'll end up going to Turkey and getting it cheap.
Yeah. So we know that if you want to have breast implants let's forget about price for a moment.
Okay.
What would be what are the three most important things?
I would want a reputable surgeon, so I'd be researching them.
And how do you pick on your reputable surgeons, would you say?
I think I'd probably look for surgeons that are in my area.
I think you can do more research if it's someone local.
Yeah.
I think there'd be more that would come up.
Yeah.
You can go and visit the clinic in person, even just to have a look.
I think that's really important to go and
actually
meet
see
them.
Yeah, and have that consultation if it's local. If you're not getting the good vibes,
yeah,
you haven't gone out of your way at that point, have you? But you'd have to think as well with the follow-ups. It's all very well, isn't it, if it's abroad?
I wouldn't even think of the follow-ups.
Would you not?
No.
I would think, no, if in the event of something not going right, where am I then going to go?
So in terms of a surgeon, apart from whether you click or not, would you specifically look at their degrees, or what would you be looking at? Would you know what to look for?
No,
Without doing this job, no. But I know, obviously, you're looking for the GMC now, but I wouldn't know that if I wasn't doing this.
Yeah.
No. Yeah, I wouldn't know.
Yeah, so that's really important. Number one, you need to make sure that they're on the GMC specialist register. And on the GMC specialist register, it will tell you where they are specific in plastic surgery. Because there are lots of people out there who aren't plastic surgeons and are on the GMC register, like
How is that happening?
like GPs
Right.
or other specialties, and they are doing breast reductions or tummy tuck and things like that. So it's really important. Not only are they on the GMC, but they need to be in the field that you want to have surgery in.
Okay, yeah. You want a specialist. I would want the best.
Yeah, if you want to have your tummy done and it's a cosmetic procedure, you would want ideally a plastic surgeon, not a GP.
But I don't think that is commonly known. Is
Yeah.
it?
So it's really easy to check. It's just GMC.
I would just assume that they are going to be a surgeon.
No, not
A
everybody.
GP would do.
There are some GPs out. I'm not saying all GPs. There are lots of reputable GPs, but there are some people on the register, GPs, and they will be doing stuff like liposuctions, lipofilling, all of that stuff.
Where are they doing it from?
They do it
From the hospitals?
from wherever. So we'll
Or
talk about
clinic.
or a clinic.
Yeah,
Yeah,
they
that
set
just
up.
accept, yeah.
That's quite worrying.
Yeah, so that's where it's really important to look GMC.
Is there like a hit list somewhere online where it tells you what
No,
you
we're
should
trying to, yeah, lots of people do. We have it on our own website. Lots of people are trying to emphasise this, and we are trying to bring it up and make it important from at a government level. But it's very difficult to regulate something like
Wow,
that.
I've learned something new on that one.
There are lots of people that don't consider liposuction and lipofilling surgery, so they may not choose to go to a surgeon, for example.
Scary.
Yeah, so yes, it's important to have a rapport, but checking that they're on the GMC specialist register is crucial.
Yeah.
And for me, if I had a family member, I would want them to have some kind of NHS experience. Because within the NHS, you see so many different things. You have access to lots of emergency tools that you can deal with, and you have you see so many complex cases, so you know that those doctors are really well experienced in dealing with complex stuff.
Yeah.
So if they can deal with the complex stuff, they're going to be able to deal with
Yeah.
recognising problems when you
Because
have
you've had all the
hospital.
emergencies coming in, haven't you? And
I'm assuming though, rightly or wrongly, that they would have had that anyway.
No, not every plastic surgeon works in the NHS or used to work in the NHS.
Really?
Yeah.
I thought you had to be like a full-on.
No, there are lots of people who have, it's important to have the training, and that's why you go on the specialist register.
Yeah.
But once you're on the specialist register, you can go fully private and not have that.
And you would never have worked in the NHS.
You would never have worked as a consultant in the NHS, no.
Okay. I think that's really important.
Yeah, and there are lots of great surgeons who have chosen to go purely private.
Yeah.
And after working in the NHS, and I might do that in 5 years' time, I might go purely private, but as I stand, I'm still working for the NHS as well as private.
Okay.
Yeah.
I just assumed that they were all like you.
There are lots of people from abroad that have never worked in the NHS ever in their life.
Okay.
They've managed to get on the specialist register as something, and then they have gone purely private.
so yeah, managing unexpected situations would be more difficult. Because you're in the NHS, you have that element of the MDT meetings as well, don't you? Bringing in all the specialities.
Yeah.
And they wouldn't have had that either then.
No, so if you do, as someone who works in the NHS, if I need to pull in exactly what you said, pull in other specialties, working in an NHS setting allows me to pull all those people in very quickly.
Yeah.
And privately you can do that, but I personally think it's a little bit more difficult, particularly if you work in quite a small bubble in plastic surgery.
So this wouldn't be commonly known when people are thinking about choosing a
I
surgeon.
wouldn't even have thought of that, if I'm honest. No way.
I know some great surgeons who worked in the NHS, they are so experienced, who have chosen to go private, and that's fine, but I know that they still have that link and they have access to the NHS. But having that accessibility, I think, for me personally, it may not be the same for everybody, but for me personally, if I had a family member, I think it's quite important.
Yeah,
I think so as well. Like when you are working in the NHS, people know you. So when people are asking, do you know a reputable surgeon, they already have you there. I just assumed all surgeons were like that. That shows how much.
No.
I've
people
had
know.
patients who have subsequently come to us for a great experience, but previously to that, they've been to someone who has not been registered, and they have not known that person is not registered.
No.
They're carrying out their consultations unregistered.
Wow, so it still happens, yeah. So very important, check your GMC register, check your surgeon, and it's ideal if they have had some NHS accessibility or experience in the past.
So this would apply to those abroad as well, would you say?
It's difficult to check out doctors abroad.
Yeah.
Yeah, and in America you have your American board certified doctors, and that's similar sort of thing.
Yeah.
Yes, you can get that. But in Turkey, I don't have much knowledge on how.
I think Turkey's really. There's obviously good and bad, because if it was all bad, no one would go.
Yeah, exactly.
But I just think for me, you've just had surgery and then you're going to be on a flight home within a couple of days.
So that's what we need to touch on as well, the fact people are unaware of the blood clots and the risk, isn't it?
There's
Because
massive risk.
if your flight is 4 hours or more, then you should be waiting 6 to 8 weeks for surgery. People are not aware of this, are they?
No.
Turkey's just on the cusp because it's that 4 hours.
Yeah.
But it's still, it's still.
I get a really good deal
Yeah.
with Turkey, because I actually don't know anyone that's been there, but I have seen documentaries on it where they will pick you up in a little chauffeur car, take you to the clinic, and it's like fine dining, then you have your surgery, and then you get your private little room and a private transfer.
So what you're saying is
It's
it's
a
made
package
very
deal.
glamorous.
Oh, it's made really glamorous, like limos picking you up. I'm not saying they're all like that, but I have seen these. It becomes that actually this is going to be quite nice. You are still going to be on a chopping block. So it's
I think every country has good and bad surgeons and good and bad hospitals. Like you say, if Turkey was that bad, nobody would be going there.
exactly. So there are good ones.
There are obviously fantastic ones.
Yeah.
I think it is a very popular place to go, and I don't want to knock any Turkish surgeon or anything.
No.
Because people there work really hard to build a business.
Yeah. But
The
the
flight
people
side
would not be aware of that, would
No.
they? The risk.
And there are risks because when people are coming back, they are then having to go straight to A&E because something's happened.
Yeah. And it's that
No
accessibility.
aftercare.
Yeah.
Yeah.
So we had a patient today.
Yeah.
She sent a photo in. She wanted to see me. I was here. She came in and saw
Yeah,
me, and
exactly.
we dealt with it within a few hours of the email. So that kind of accessibility to your actual surgeon that did the surgery.
Yeah, you're not going to
Isn't
have that
there?
here. You're then going to have to rely on the NHS, which again, there's only so much that they will be doing.
Yeah.
They will be fixing it, but they're not going to reconstruct that.
Yeah.
See, I would say that's got to be almost the number one consideration then when you're thinking about where to go, wouldn't you?
Yeah.
All the what ifs following the surgery.
There are.
It could be life threatening, couldn't
Yeah.
it?
People underestimate the recovery.
Yeah.
Totally underestimate the recovery and the need to rest and the accessibility to a doctor or a nurse after, even if it's just to put your mind at rest and reduce the stress levels. And you don't get that if you have surgery far away.
I think I'm too much of a worrier to do it, to go abroad and have something done because I would want to have access to you. That would be my thing. But equally, how much cheaper is it to go abroad and have? Is it?
Oh,
is
it's
it?
massively.
Is it?
Yeah.
Maybe I'll
Even
take,
I
maybe I'll
think-
take a risk then. I'll see.
Yeah. People are willing to take that risk. If it's £3,000, £4,000 to have a breast augmentation
You
versus
get a bit of a 5-star holiday.
and you have a 5-star holiday versus whatever £8,000 to £12,000 in the UK.
Yeah, but yeah, if you do your research and they're great, I don't know. I'm too much
Do you
of a
think
worry.
they are just expecting then, oh, if anything goes wrong, I'll just ring 999?
I
would.
Or I'll just go to A&E?
Yeah, why would you not? I pay my taxes.
People are, they pay their taxes, and it's a very. People are desperate, aren't they, when they want to have it
Yeah.
done?
I would just assume that you would just get fixed. As in, if I go to A&E, they're going to help me. They're not going to necessarily turn me away, are they?
No, they're not.
But it depends on what's gone wrong.
Yeah, no one's going to turn you away.
No.
Okay, so let's say you've chosen, you want to be close to the UK, you want to have access. How would you choose the hospital, for example?
I don't think it's really the hospital. It's more the surgeon for me.
Is it the surgeon?
Yeah, I would travel to a point. I'd go to London for the right surgeon.
Yeah, so
Yeah,
So you leave it to the surgeon to decide where they choose the surgery.
yeah.
Would you go out of your way to research where they have the surgery?
I think you naturally would look at
Oh,
those things,
yeah.
wouldn't you? Yeah, and
Well, I don't know.
even if from choosing the surgeon you then said, we'll do your case in London, I think you'd still then look up that clinic or hospital
Yeah.
and see. You just want to check the credibility of everything, wouldn't you?
It would be surgeon first, then
Yeah.
the
And
hospital.
then, because the surgeons work sometimes in different hospitals. Here they work in the NHS,
Yeah.
they work in the private hospitals. When you say reputation of a hospital, what kind of things do you look for?
Has anybody died of plastic surgery here?
Yeah.
That's what I would be looking for. And then looking for the name.
Yeah.
Because the thing is, they're all the same.
That's another interesting one. So one of the things that theoretically you should be looking for is whether it's CQC approved. So you know, like we have doctors, they're on a GMC register.
Yeah.
The hospital needs to be CQC approved, so it's met all the government health and safety.
Why would it not have already hit that?
That's the thing. There are lots of clinics out there,
Oh, clinics or hospitals?
clinics or people that are set up to do surgery that don't have CQC registration. So
Sure, we get-
even with our place here, we have a full-on CQC registration, but there are places even like this that don't.
I don't think people would know that they need to check that. That's not commonly known.
No, I just assume that if you've got a practice, then you are like legit.
Yeah, I think it's worth looking at that. If you have a legit doctor, they will work in a CQC hospital because that's
Yeah.
the standard that they will work at. But there are some people who may get fooled by the glamour, who may get fooled by, even if you're on the GMC register and they're not in an NHS hospital, you might find that they do surgery and surgical procedures in a non-CQC registered location?
I think it's really difficult for people.
I know,
actually.
it's so difficult. It is really difficult
Yeah.
for them to decide on, because it's a cowboy world out there.
Yeah, it's actually worrying.
Like with anything, that exists in anything, but yeah, that does make it difficult. I think you'd look at the hospital that you've been recommended to go to for reviews, and you definitely would do a bit of research on it, wouldn't you? But yeah, maybe not necessarily knowing about the CQC.
Yeah.
There should be something online where they say these are the things that you need to look for when
There is,
looking.
but people just don't know where to look. It's
Yeah, I
actually,
don't know to look.
the BAPRAS website has a lot of information. The BARPS website, they're the two aesthetic areas. So there is, the problem is that it's just so much information out there on the web that nobody really knows.
And you do trust who you're talking to,
You
so
just got to trust
you
your...
don't trust everything you say. So
There's the element, isn't there, of word of mouth as well. If someone's had family or friends,
yeah, and
then they're comfortable
and
to
you-
go with.
yeah, and we get a lot of that, don't we?
Yeah.
My friend had this here, and so you do get a lot of recommendations for sure.
A lot of NHS hospitals now do private work. And would you ever go to an NHS hospital to have private work done?
Yeah.
Yeah, I think
I think it's a brilliant location to
Yeah.
do private work. Number one, because I have such a high turnover of patients and such experience in dealing with complex cases, everything is always met at a particular standard. The instruments are always what you would normally use. The nurses are what they...
Yeah, I mean, I think for surgery, I'd want it at a hospital. I don't want to go in someone's...
Yeah, but there are lots of kind of private hospitals that are tucked away with small... They've got glossy fronts, but they've got quite small theatres.
Is that... Won't name the name,
Yeah.
but obviously where I went, that's classed as a...
Yeah,
okay.
yeah.
Okay, I would do that.
Yeah, so if you go to an NHS hospital, I mean, there's options to... There are great private hospitals, but for me, I like the NHS hospitals because you have access to everything.
Oh, so I'm gonna go against what I said.
Yeah.
I would have gone to a private one, preferred to have gone to a private one, because I would have thought that you'd get the best of the best. But that actually probably isn't the case. Or
As in the private...
yeah, I just assume I'd get the best doctors, the best equipment, because it is private and I'm going to be number one priority.
That's not necessarily the case. No, but working in an NHS, having private work in an NHS hospital, they meet such high standards.
Really?
Yeah. You may not get the nice coffee.
As I said, I had a really nice meal.
Yeah, you may not get a nice coffee in an NHS hospital.
I'm only going to get my own room.
You may not even get your own room.
Oh no, it's just...
But the operating room
Is better?
I find, is good.
Okay.
And also, the hospital fee that you pay towards the NHS goes to maintaining the actual NHS hospital.
Okay.
Yeah, so if you, you're paying for NHS nurses, you're paying for, so there is like that altruistic approach to working to having private work in an NHS hospital.
Okay.
And
I wouldn't have thought
the
that.
private theatre work is only done when they wouldn't be operating on NHS patients as well, isn't it? On a day where it wouldn't be in use for NHS patients.
So you're
it's
not
not
taking
instead
away.
of.
Exactly.
You're not creating a longer waiting list. It's
No.
if they don't use the theatre at the weekend,
Yeah.
then that can
Is
be
it mainly
the
weekend
private.
work for private then?
It depends on which hospital you go in. There are
Okay.
lots of hospitals that do private work. and
That's
they
really
do-
interesting.
yeah.
I honestly would have thought going private, you are going to have, because for me, you're spending all this money. I'd assume that would be the safest, the best.
No. The most expensive does not necessarily mean the best.
You've experienced substandard
Yeah.
in places that are just private, haven't
Oh
you?
yeah,
So,
and I've moved just because their instruments have been 20 years old, and it's I can't do this to my patients. Yeah, and they do listen to you as a surgeon working in the NHS because you are their main workhorse. And you're employed by them.
Great, so you make me feel like I had really old machines.
No, but it's fine.
That's all right.
Yeah,
Okay, so that's really interesting.
you go private, but in an NHS hospital.
That's what I meant.
Yeah, you go private, but your surgeon will choose.
Okay.
Your surgeon will make that decision for you. But I think there are lots of benefits having private work in an NHS hospital.
Yeah, if something goes wrong, at least you know you've got...
Everything around you.
Yeah.
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 That's actually really interesting.
Yes, really good.
That makes me rethink my little surgery that I had, to be honest. But if you go private, can you ask to go in an NHS hospital or not?
You just speak to your surgeon and the surgeon will make the final call.
Okay.
Surgeons have admitting rights in different hospitals, so if they have, or privileges to work in different hospitals, so if they have the privileges to work in an NHS hospital privately, then yeah, you can work there. But if they don't, then they'll take you to a different CQC registered hospital.
Well, I've learned a lot today.
Are there any other considerations then, would you say, with
For me,
looking at the registration, looking at where...
Do you
where
find
else?
I've got a question, sorry.
Yeah.
Sorry, I cut you off completely then. That's really rude. That's really rude. Sorry. It was in my head. But do you find that you have more women wanting to come to see you for stuff than men because you are...
I don't
Yes.
know. I can't tell, because private practice is very private. We work very isolated.
Yeah.
And although we work in teams, and I'm quite open and I talk about things and complications, not everyone is like that. So I wouldn't know what my colleague is seeing in a different hospital. So I can't tell.
No, okay.
I don't know because we don't talk to each other about.
Would you rather see a woman or a man?
A woman.
Yeah, me too. I wouldn't want to see a
If
guy.
it's dealing with your body, it feels
Yeah.
more comfortable.
But back to your question, are there any other considerations that I would do apart from, for me, it's just having trust in your surgeon. That's just the thing. And sometimes you may not click with your surgeon and your surgeon may not click with you. And if I feel that I'm not going to be able to meet the patient's expectations, or I'm not providing the patient the information in the format that they understand, which is a crucial part of patient management, I might choose to say, no, I don't think this is going to work. Even though surgically it will probably be fine, but it's that post-operative recovery period of getting things right and keeping their...
Actually, something else that comes into my mind. So even if you've done all this, you've found the registered person, you've got the right surgeon, where it's going to be, actually you still have to prepare yourself that you might be told you are not suitable for surgery. And that's like emotionally, that's actually quite a big thing, isn't it? What you think is a problem or what you think can be fixed. Actually, you might have a consultation and you say that's just not suitable. And that can be quite devastating, can't
just
it?
managing patients' expectations.
So actually being prepared that what you think you want might not be a possibility, might not be good for you, might not be in your best interest.
And that's the thing, might not be in your best interest is something that is very difficult to gauge and it can be difficult for the patient to absorb. So if I say, yes, I can do this, but the risks are way too high, a number of that's why I don't feel it's safe to continue. There are so many patients that will turn around and say, I'm willing to take that risk.
And we'll go with a different surgeon.
And I'll be like, I'm not willing to take the risk. And they're like, I'm willing to take the risk. I don't mind the massive high risk of infection and I'm going to continue to smoke and blah, 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 blah. And you've just got to say, I'm sorry. I'm happy for you to explore other avenues. So
People need to prepare themselves for that as well, actually, don't they?
That's a really good one, because you would just assume that
you
could fix everything.
And also people assume because you've gone privately, then because they're paying, they can have anything they want.
I would assume that,
No, just because you're, I don't care how many thousands of pounds you pay me, if I say I can't do something, the risks are too high, it's not going to change my mind and get me to put you on the table. It doesn't work like that.
No, and I think it's really good that you do that and you don't just go, oh, yeah, that's fine. I'm sure there's some people out there that will just do it and take on the risk. And then it goes wrong. And then that's just not fun.
And then it's not fun. Anyway.
Lots to think about then before going down this pathway.
The other one key thing that I quickly want to ask is, do you think photographs are important? Pre and post of photographs on Instagram and things like that?
It's requested a lot.
I think sometimes, especially with the boobs, when you take the first it's not pleasant.
Mm.
And somebody I remember hadn't seen photos of what it would, and she looked quite shocked.
At the wounds. do you
Yeah,
mean?
because it is. I don't know. You know that there's obviously going to be blood and everything like that, and all, but you know it's not going to look like fresh boobs. But wow, some of those that you see, and the nipples all stitched in, it does look a bit. No offense, I mean it's not pretty. Don't worry though. 2 weeks later, it starts looking really lovely. But I think trying to get your head round that, but it does get better. But it is that whole.
Yeah, because we're not exposed to this day to day, are we? The
No.
normal person, you're not exposed to fresh wounds and fresh stitching and what it all looks like. You see it with every operation that you do,
Yeah.
but yeah, it's a good point.
Yeah, I think it's really important to see.
Is there any drawback for not being able to put pictures? Is there?
We're not really, you have to ask for permission.
Yeah.
And I prefer not to put all breast and abdomen and things on the internet, because AI out there can generate things and you don't know what they can figure out from photographs, what kind of identity they can get, how they can manipulate those photographs. So I'm just very cautious about putting private photographs up. I can show them.
Yeah, I think it's really important to when you are having surgery to ask to see post-ops, because they would have taken photos. You have to, don't you?
Yeah.
You don't have to, but
Do
we
you not?
No, we do.
I know we do,
Yeah.
but do other surgeons?
There's no legal obligation.
Okay, I think it's good though, just to see, because it may put you off.
May put you off, and that's what my key is. I try and put people.
You really do. Yes, you do always try and put people off
Yeah.
having surgery.
What's the key take-home message for you?
Do your research.
Yeah,
Look up
absolutely.
everything you've just
And
talked
visit-
about, and
Visit the premises.
Yeah, your research. GMC registration key. Figure out where they do their work,
Yeah.
and look at whether they have had any NHS experience.